Hello, my name is Elise Bacabella, and today I will be discussing my professional philosophy for my course, Philosophy and Principles of Health Education at the University of Florida. Before discussing what my professional philosophy is, it's important to know a little bit about my background. I am currently working as a certified registered dental hygienist in the state of Florida, and I have been working clinically for approximately 2 years. Starting in May, I will also be starting to work as an adjunct faculty instructor at a accredited dental hygiene program. Therefore, I will be working both clinically and at an educational setting. So I did provide two professional philosophies, one having to do with education, one having to do with my clinical work. So firstly, establishing an environment among students that aids in the acquisition of knowledge and confidence to help them provide patients with the best patient care. My other one is going to be to provide a trusting and positive environment for individuals to better their knowledge and skills to help them acquire a form of optimal health that best fits them. The four main areas that will be discussed that show support to my two professional philosophies are empowering individuals in an educational environment, providing knowledge to better individuals and communities, promotion of self-efficacy, and promotion of autonomy. I will empower individuals in an educational setting. We know that educators have a big impact on students. Therefore, it is important to empower individuals and provide a safe learning environment for them to acquire these skills that we are going to teach them. So, looking at my three supports of my main support, promotion of well-being and empowerment in educational settings provides a reduction to unwanted health behaviors and aids in educational achievements. So like I stated, an educator provides a big impact in empowering students and in how these achievements of these educational achievements can then aid in proper utilization in the projected field that they are looking to provide. So I would love to be able to provide individuals with an empowering educational setting so that they're able to have these educational achievements and use these skills to better the community. A quote that I felt fit this was, "Education is the most powerful weapon which you can use to change the world." Once again, education is so important, but it's up to educators to sit there and provide the knowledge and empowerment for those students for them to best be able to use that knowledge that we are giving to them. Lastly, empowerment can take place at many levels and influence each other. So we know from the information that we learned from this course, especially from the book that we had to read that had to deal with Dr. Wen, we know that even at small strides can still provide influence, can still empower individuals to make a change. So even in small strides, we are able to provide individuals with an empowering educational environment that they can then use this education and this knowledge that we have given them to aid in bigger change. And that's something that I would love to provide to those that I'm able to educate and inform. I will provide knowledge to better individuals and communities. Healthcare professionals need to provide health education and promotion information for those that they serve to make informed decisions. As a dental hygienist, I am already helping my patients make informed decisions on their health, but I would love to continue doing this by working in my clinical setting, by being able to provide that knowledge for those individuals or even communities if I am going to work at a bigger level to then help in behavior changes and whether that's implementing or changing health behaviors. Increasing individuals or group information and knowledge allows those to make better decisions. Like I stated before, providing that knowledge then helps those in return. Providing education to individuals allows for a positive effect on the healthy lifestyle they are seeking. I will aid in the promotion of self-efficacy. Not only from this particular class that we are taking, but from other courses at the University of Florida, especially ones that focus on theories. We know that self efficacy is very important. Having that confidence and making sure that we are providing both students, if we serve at an educational setting, or, individuals and communities, depending on who we are serving as health education specialists and healthcare providers, being able to provide that confidence and making sure they are confident in whatever they decide to do with their health and health behaviors, it is vital. We know that self-efficacy is a vital component in the health belief model, and without it, we can definitely see how, behavior change can definitely dwindle. So, self-efficacy has a powerful influence that can aid in health promoting behavior, which was I just went over. Self-efficacy also provides an understanding and can forecast health behavior change and maintenance. So, like I was saying, using these theories and models, especially the health belief model, since self-efficacy is one of the main components, we can try and distinguish and understand what someone may or may not do based off of how confident or non-confident that particular person may be. I will aid in the promotion of autonomy. Everyone is entitled to make their own decisions about their health, and this is something that we definitely need to focus on, especially, with certain events, thinking about COVID-19, everybody was entitled to their own autonomy, whether they wanted to get the vaccinations or they did not want to get the vaccinations. As a healthcare provider or health education specialist, we can only promote and give information so much to individuals, but we also need to understand that each person has their own autonomy, and we need to promote that because they need to understand that we are here to help them, but we also want them to still have a sense of self-identity and being able to make their being able to make their own decisions as well. So autonomy provides for better patient outcomes and satisfaction, then leading to a better rapport. So, like I said, building that rapport is so important, and that is something that I strive for with my patients. By giving them the information they need, they're able to make informed decisions, but they're making those decisions on their own, therefore showing their autonomy. Autonomy also allows for better patient involvement, encouragement, and motivation. So, being able to provide these three key components, involvement, encouragement, and motivation, it then aids in the rapport as well with your patients, but also it provides the patients with a sense of control for what they may be trying to implement as a health behavior or what they may be trying to change. So, to sum everything up that we have spoken about in terms of my professional philosophies, but also those four main supporting points, healthcare professionals hold an important role in being educators for both patients and others that we serve. So, it's important to be able to properly educate and provide that guidance to our patients. As a dental hygiene instructor, I will be able to provide knowledge to those I teach and be a role model of how to properly serve the community through oral health. I would like to use my personal experience as a clinical hygienist and being able to bring in real world experience to properly help these students in being able to give them not only a positive and supportive environment to learn from, but also they are able to learn from different experiences that I have, and they can take that forth into the workforce once they have then completed the dental hygiene program. Lastly, by bringing a sense of confidence, being forthright with information, and promoting autonomy, I will be able to aid those in both a clinical and educational setting. I hope this explained my professional philosophy, and I hope this gave you a little bit more of insight of what I would like to do in the future and also who I am as a person. Thank you so much.